It is my distinct pleasure to introduce the Dean of Harvard School of Dental Medicine, Dr. Bruce Donoff. Dr. Donoff embodies the bridge between our two schools. He received his DMD from Harvard School of Dental Medicine and then went on to earn his MD from Harvard Medical School as part of his residency in oral and maxillofacial surgery at the Massachusetts General Hospital, where he continued his work, being named chairman and chief of service in 1983 and continues to see patients at the MGH. He has served as our dean of the Harvard School of Dental Medicine for over 25 years. In his career, he has authored numerous papers and been the recipient of some of the highest awards, including the Alpha Omega Achievement Medal, an honor shared with Dr. Albert Einstein. Pretty good company to be part with. It is my sincere honor and privilege to introduce our beloved Dean of the School of Dental Medicine, Dr. Donoff.
Good afternoon and congratulations to everybody. This is such a special day for the graduates of the Harvard School of Dental Medicine and Harvard Medical School. The class of 2018. Congratulations to you and your loved ones who have helped you reach this point in your lives. You are at a major milestone of a long journey of education and training designed to permit you to help people through the discovery, application, and communication of knowledge, competence, compassion, and caring. The development of wisdom and clinical judgment through lifelong learning and further experience represents the road ahead. Each year I associate the graduating class with a particular event or accomplishment. Last year it was the 150th anniversary of the dental school at Harvard University, a momentous occasion as it was the first dental school in America associated with a university and its medical school. This morning, when I presented the degree candidates to the president of the university at commencement, she granted their degrees and welcomed them into a demanding branch of medicine. I can remember your class for a remarkable group of DMD graduates who have published more papers than any other class. As a matter of fact, 5 times more than the largest dental school class in America. Moreover, these scholarly endeavors were on important issues from healthcare delivery to cutting-edge basic science. This past year, the school went through a full accreditation and received a report with no recommendations. Perfect. This is also the last class, as was mentioned, of the new pathway curriculum, and that I had the pleasure to teach Patient Dr. 1 on Monday afternoons. Will those home society students please stand up to be embarrassed? I could not let this opportunity pass without remembering 2 giants of the Faculty of Medicine, both of whom passed away on September 6, 2017, and had an immense impact on education of Harvard dental and medical students. Walter Gorelnik and Daniel Fetterman will be remembered for far more than the professorships that bear their names. Primarily clinicians, they both saw the importance of the integration of oral health and medicine and worked together to forge important curricular programs. In 1971, Dr. Gorelnik championed a program that added surgical training and medical education to the playing field of practice. This first program, started at the MGH and Harvard, is now mimicked by almost 60 others. In fact, 11 of you are entering such programs around the country. Implemented as a Harvard-centric program during the 1980s, it was Dr. Fetterman who helped permit qualified graduates of other dental schools to enter our program. It was also Dr. Fetterman who called me one day when I was chief of oral and maxillofacial surgery to say that he had attended a AAMC meeting and attended a session on teaching medical students about dentistry and oral health. So I, at the MGH, along with Steve Sonis at the Brigham, initiated sessions for medical students during their clerkships in the essentials of dental medicine. Currently, our initiative to integrate oral health and primary care medicine seeks to advance the the education, clinical practice, outcomes, and policies regarding comprehensive disease management and the economic imperative of good oral health. We work with the medical school's primary care center to foster integration and hope to create an integrated medical dental practice that will be a teaching unit for all students. When I had just become professor, I had a series of patient encounters that were remarkable because of the patients involved and because each was prescient of the remarkable future of healthcare that you, the graduates, are now entering. I had a patient present for a tooth extraction. I had seen him a year before. He said hello and then told me to put on gloves before examining him. Mind you, most dentists and physicians did not wear gloves for general exams at the time. It was 1982. He had just had a bone marrow transplant, developed graft versus host disease, and had something called HIV infection. A disease that was a diagnosis for death is now a treatable illness. That is part of healthcare's past and future, and science made it possible, although not a total solution. I also recall a group of a dozen young women with tongue cancer. They had none of the usual risk factors. And despite detailed study of them, we could not identify a reason for them to have such cancers. However, just recently it was shown that these patients have a biomarker PD-L1, which can be a very useful indicator for patients, young patients with a relatively well-behaved tongue cancer. Medical treatment of surgical disease is becoming a reality for dental decay as well as cancers, and science makes this possible. We've come a long way since Australian physicians Barry Marshall and Robin Warren won a Nobel Prize in Medicine in 2005 for the discovery that gastric ulcers are caused by bacteria. The discovery of Helicobacter pylori was groundbreaking and opened up the study of the human microbiome, which is so important to today's understanding of many diseases. It will just take one of you to discover how the human immune system turns these normal inhabitants into pathogens to really make a difference. So congratulations to the 34 individuals receiving the DMD degree, the 7 with honors in a special field, and the 6 receiving the degree with general honors, the 13 receiving the Master of Medical Science, and the 4 receiving the Doctor of Medical Science degree. And congratulations to the residents and fellows who are receiving specialty certificates and will go on to make an impact in their chosen field. Always remember, we are privileged to take care of people. Treat them well, treat them kindly, and treat them with great respect. Above all, treat them all equally with one high standard of care. Don't allow missions of mercy, thousands of people lined up for free dental care once a year, to become the profession's scar of oral health delivery for the underserved. Don't permit our growing elderly population's oral health needs from being excluded from Medicare as they are. Your achievement should make you very proud. Those who have helped you reach this day and those who have nurtured and sustained you share that pride. The entire HSDM community and I feel no small measure of joy and pride in your accomplishments. We look forward to your futures with justifiably high hopes. Congratulations, class of 2018. I hope your memories of HSDM and HMS will always remain a treasured part of who you are and who you become. Be the leaders you are in transforming our healthcare world through science, policy, and compassionate care. Most importantly, do the right thing, especially when no one is watching. Thank you.